Welcome to the SEIU Healthcare webinar on Ebola preparedness. I'm LaDonna Howard on staff with SEIU Healthcare in the Washington, D.C. office and recording this audio for this presentation on behalf of Ingela Dahlgren. Ingela is a registered nurse and the director of the SEIU Nurse Alliance of California. She has been sharing this presentation with our nurse members in California, and she asked if we could record and share this presentation more broadly. So thank you, Ingela. The information in this presentation is accurate as of October 21st, 2014, and incorporates information and guidance from the Centers for Disease Control and Prevention, the CDC, and from OSHA. Please be aware that information is changing rapidly. We're working to keep this up to date, but be sure to also check for the most current resources from federal, state, local agencies, and employers. This presentation is for SEIU healthcare members to learn a little more about the Ebola virus. We will cover some basic facts about the virus. We will review signs, symptoms, and steps to diagnose the virus. We will spend most of our time talking about the transmission of the virus, especially in hospital settings, and the current guidelines and recommendations to protect healthcare workers from exposure. And we will end with some specific suggestions for union members regarding working with our union hospitals to get prepared. Just briefly, a few things that we do know about this current strain of the virus and the current epidemic. This is the largest Ebola epidemic in history, and it's affecting multiple countries. About half of the people who get Ebola in this outbreak have died, though cases treated in developed countries have a higher survival rate. There is no cure, but there is treatment. Treatment consists of aggressive rehydration and support for symptoms. We know that Ebola can be spread to others after symptoms begin. Symptoms can appear anywhere from 2 to 21 days after exposure, though about 8 to 14 days is most common. Ebola seems only to be spread when people are sick and showing symptoms. Some news about the outbreak in Africa. You remember the summer when a dying Liberian-American man flew to Lagos, Nigeria. Since then, 20 people have become infected and 8 died. But due to aggressive containment work to trace every contact, Nigeria has not seen a new case since August 31st, and the World Health Organization has declared Nigeria free of the virus, so Ebola can be contained. According to the CDC, these are the main signs and symptoms of Ebola. In almost all cases, the person has a fever as the first symptom. Other symptoms may include severe headache, muscle pain, weakness, diarrhea, vomiting, abdominal pain, and unexplained bleeding or bruising. But is it Ebola? Early recognition is crucial, both to give the patient the best chance for survival and critical for infection control, so that we can isolate the patient from the community and other patients and protect workers from the virus. The CDC suggests these 4 steps for healthcare workers during an outbreak of Ebola in order to safely diagnose and initially care for a sick patient. First, think Ebola. Take a detailed travel and exposure history. In the past 21 days, has the patient had either one of 2 risk factors? Have they been to an area with Ebola, or have they been exposed to a known Ebola patient? If either of these 2 answers is yes, then assess, do they have a fever? And any additional symptom. In the very early stages of the disease, they may only have a fever. If the answer is yes to risk factors of exposure and symptoms such as a fever, then the facility needs to activate their response plan. Your facility should have a detailed and specific plan for your site, not just a generic plan or a printout of the CDC guidances. The plan must include at least the current CDC guidance, which we will talk about shortly, and must adhere to any federal or state OSHA requirements that apply to your facility. We will talk more about facility-specific plans later. If a facility has a possible case of Ebola, the state or local health department should be notified. You can also contact the health department if you don't know how to proceed at that point under your facility's response plan. The health department and CDC will work together with your facility to determine testing. And the CDC has some specific advice for healthcare workers on the front lines as soon as an Ebola patient is identified. They call this care carefully, and their guidance includes immediate activation of site-specific plans as soon as you have a potential Ebola patient, isolating the patient in a separate room with a private bathroom and a closed door. The CDC also recommends facilities maintain a log of all persons entering the patient's room and to consider posting personnel at the patient's door to ensure appropriate and consistent use of personal protective equipment by all persons entering the room. Reassure the patient and family that appropriate care will be provided. That statement comes directly from the CDC, but we want to emphasize this and acknowledge that just as nurses and healthcare workers were on the front lines of treating the AIDS, HIV epidemic in the early days, and were able to do so with respect and dignity for their patients at a time when fear and panic and anti-gay rhetoric was high in the country, SEIU healthcare members are committed to ensuring that all patients are treated with respect and dignity during this current crisis as well. And consider alternative diagnoses. Ensure the patient has the ability to communicate with family. This might be through a telephone. The CDC recommends that physical contact in healthcare settings be limited only to what is medically necessary and to be done only while wearing appropriate personal protective equipment, or PPE, and we'll talk more about appropriate PPE shortly. The CDC says to not perform any elective tests or procedures to minimize sample collection, lab testing, and diagnostic imaging. Limit the use of needles and other sharps as much as possible. Phlebotomy, procedures, and labs should be limited to only what's necessary for essential diagnostic evaluation and acute medical care. The CDC now even recommends that family members do not visit without putting on PPE, though you could provide a telephone for family to communicate directly or ensure that a member of the care team stays in touch with the family. Transmission in healthcare settings. These are all considered high-risk exposures by the CDC. Needle sticks, mucous membrane exposure to blood or body fluids of the patient, direct skin contact with or exposure to blood or body fluids without appropriate PPE. We'll be talking about appropriate PPE next. Also processing of blood or body fluids and direct contact with the dead body of an Ebola patient. The CDC also now states to avoid aerosol-generating procedures as much as possible. Although there are limited data available to definitively define a list of aerosol-generating procedures, these usually include BiPAP, bronchoscopy, sputum induction, intubation and extubation, etc. Now let's talk about PPE, personal protective equipment, in healthcare settings when treating an Ebola patient. This quote is from a published article by Drs. Lisa Brousseau and Rachel Jones at the University of Illinois at Chicago. They are acknowledged national experts on respiratory protection and infectious disease transmission. In May, they published a similar commentary on MERS. In their article, they recommend applying the precautionary principle in cases of Ebola. The precautionary principle, which means any action designed to reduce risk should not wait scientific certainty, they say compels the use of respiratory protection for a pathogen like Ebola. They state in their article that, quote, "We believe there is scientific and epidemiological evidence that Ebola virus has the potential to be transmitted via infection aerosol particles both near and at a distance from infected patients, which means that healthcare workers should be wearing respirators, not just face masks," end quote. They suggest a minimum level of protection in high-risk settings should be a respirator with an assigned protection factor greater than 10. A powered air purifying respirator in the photo here with a hood or helmet offers many advantages over an N95 filtering facepiece, being more protective, comfortable, and cost-effective in the long run. It is important to note here that aerosolized transmission is not the same as airborne. If the Ebola virus were currently airborne, we would likely have seen more than 20 cases in Nigeria, and likely more than the currently 2 cases from the patient in Texas. So the Ebola virus is not spread like tuberculosis or measles, but healthcare workers are engaged in high-risk activities during patient care. And if aerosolized procedures are taking place, anyone in the room with the patient at that time or shortly after up to 24 hours according to a recent CDC document, may be at risk without the proper PPE. In fact, the CDC has issued new, more stringent guidelines for healthcare workers caring for Ebola patients. On October 20th, the CDC stated that workers should wear a respirator, along with double gloves, a fluid-resistant impermeable gown, a single-use disposable face shield, hoods to cover head and neck, and more. One important new part of the CDC guidelines is that there's to be no skin exposure when PPE is worn. This quote from the CDC talks about the importance of training so that all healthcare workers understand how to appropriately use the equipment. The CDC states that all healthcare workers should undergo rigorous, their word, training, and be practiced and competent with PPE, including how to use the equipment and putting it on and taking it off. The new guidelines also recommend designated areas for putting on and taking off the PPE with a clear separation between the clean, putting on area and the potentially contaminated taking off areas. The new guidelines also recommend disinfection of gloved hands using a specific disinfectant between each of the steps of taking off PPE and to disinfect any visibly contaminated areas of the PPE prior to removal. Also regarding PPE, the CDC states, quote, "Facility leadership has responsibility to provide resources and support for implementation of effective preventive precautions. Management should maintain a culture of worker safety in which appropriate PPE is available and correctly maintained, and workers are provided with appropriate training." In addition to the PPE guidelines, the CDC also has specific recommendations about other aspects of hospital infection control practices for Ebola, and the CDC also refers hospitals to OSHA's bloodborne pathogen standard. The CDC has provided an extensive document and a FAQ, frequently asked questions document, that covers hospital disinfectants, cleaning of Ebola patient rooms, disposal of materials, etc. One commonly asked question is about how long the virus persists in indoor environments, and the CDC says that based upon data, the expectation with, quote, "consistent daily cleaning and disinfectant practices in U.S. hospitals, the persistence of Ebola virus in the patient care environment would be short, with 24 hours considered a cautious upper limit." Remember, Ebola is not an airborne disease like TB or measles, but it is possibly aerosol transmitted, which is why the CDC is now recommending strong PPE guidance. Due to the importance of EVS workers in hospital infection control, the CDC has some guidance for EVS staff and guidance regarding infection control cleaning practices as part of the care of patients who are under investigation or with probable or confirmed Ebola virus infections. EVS staff should wear recommended PPE equipment when in the room. An EPA-registered hospital disinfectant should be used to disinfect the environmental surfaces in the room after the room has been cleaned. As a precaution, selection of a disinfectant with a higher potency than what is normally required for an enveloped virus is being recommended at this time. Avoid contamination of reusable porous surfaces that cannot be made single-use. So, no carpeted rooms, no upholstered visitor chairs, no decorative curtains, etc. Use only a mattress and pillow with plastic or other covering that fluids cannot get through. And to reduce exposure among staff and other patients to potentially contaminated textiles while laundering, the CDC recommends discarding all linens, all non-fluid impermeable pillows or mattresses, and all textile privacy curtains into the waste stream and disposed of properly. The Ebola virus is classified as a Category A infectious substance and regulated by the U.S. Department of Transportation's Hazardous Material Regulations. This includes medical equipment, sharps, linens, used healthcare products, used PPE, and byproducts of cleaning. In addition to CDC guidelines, some hospitals are also required by law to follow additional OSHA, Occupational Safety and Health Administration regulations regarding worker safety and infection control. Some hospitals fall under federal OSHA guidelines. California is a state that has its own OSHA division. By law, hospitals that are covered by any OSHA jurisdiction must follow those regulations. I'm going to briefly walk through the specific Cal-OSHA guidance on Ebola that was issued this month. This will be helpful for our members in California and may serve as a good model for other states. Just quickly, the new CDC guidance are very close to the Cal-OSHA regulations, although Cal-OSHA issued these earlier, and so California hospitals have had a little more time to prepare. As you can see, these track the current CDC guidelines pretty well, and in fact require hospitals in California to abide by whatever CDC's current PPE guidelines are, so that as the CDC guidelines are updated, Cal-OSHA expects those to be followed in their hospitals. Cal-OSHA also mentions not only all healthcare workers, but other workers as well. Any worker in a critical sector who may come into contact with sick individuals or their body fluids are covered by Cal-OSHA regulations. The Cal-OSHA bloodborne pathogen standard applies to all workers who have occupational exposure to blood or other potentially infectious materials. This also includes housekeeping or other personnel responsible for disinfecting areas occupied by Ebola patients. These are just some of the key provisions. As you can see, Cal-OSHA requires training about Ebola, protective measures, and what to do in the case of an exposure incident. All workplaces that cover any worker mentioned should be doing this training. Ebola is also covered under Cal-OSHA's new Aerosol Transmissible Disease Standard. This regulation requires the use of respiratory protection at least as effective as the NIOSH-approved N95 respirators for workers who perform or are exposed to aerosol-generating procedures like those mentioned earlier in this presentation. Donning and doffing PPE. Donning means putting on personal protective equipment, doffing means taking it off. The Cal-OSHA regulations go into a lot of detail about how this should be done in order to minimize exposure. This includes a designated area for removing PPE that's separate from the clean area where it is put on, requires training of employees about this. The new CDC guidance now recommends these steps as well. Cal-OSHA also requires a designated employee to assist with donning and doffing and has other information in the Aerosol Transmittable Disease Standard to help facilities with these specific steps. As was mentioned earlier, every facility that could see an Ebola patient needs to have a site-specific plan that lays out exactly how the regulations and guidelines will be followed. For example, CDC and Cal-OSHA say that an isolation room is required. Where is that isolation room or isolation rooms in your facility, and what are the steps for an admitting clerk or a receptionist or a triage nurse who suspects Ebola to take to ensure that the patient gets to that room in the safest manner possible? The guidelines say that workers need to be trained in how to use PPE. When will those trainings be held, and how will the facility ensure that every relevant worker is able to attend? These are just a couple of the types of questions you might have about your site-specific plans. As frontline workers who may be exposed to an Ebola patient, you have the right to request your facility's plan. Let's talk about some ways you can do this. There are details that your facility needs to work out and needs to communicate to all of the relevant workers. Simply referring workers to the CDC website, passing up printout of the CDC guidelines, or showing a short slide presentation like this one is not all that is needed. Hospital management should review infection control policies and procedures and incorporate plans for administrative, environmental, and communication measures, as well as personal protective equipment training and education. Hospitals should also define the individual work practices that will be required to detect the introduction of a patient with Ebola, prevent the spread of Ebola, and manage the impact on patients, the hospital, and staff. We also want to point out that the Department of Health and Human Services and the CDC have Ebola preparedness checklists and guidelines not only for hospitals, but also specific guidelines for outpatient and ambulatory care centers and emergency medical services. The first thing to know is that it is your right to ask for site-specific plans. And your facility may need help getting ready. Concerns and ideas from frontline staff are valuable. You may be able to identify gaps in the real-world implementation of site plans. Try to open up a conversation with your employer in a non-confrontational way. Ideally, you'd like to work as an equal partner together to prepare and to train. If your facility has existing labor management union committees, you could use these committees to request the infection control and occupational health plans for Ebola, which should incorporate the current CDC guidance. Your committee could review the facility plan together by comparing it to the hospital checklist for Ebola preparedness that's been developed by the Department of Health and Human Services and CDC, and that's available on the SEIU website. Local unions and our members should be included in the development, periodic review, and implementation of the plans. SEIU member involvement and experience are key to a plan that is effective in providing care for these patients while protecting the health and safety of our members. But you don't need to wait for a committee meeting. You could also ask for a special meeting with management dedicated to discussing this. You could suggest that this meeting is to explore ways that the union can help in a cooperative manner in Ebola preparedness. SEIU International has all of the detailed materials that were referenced in this presentation and more, and can provide them to you to share with your employer. You can find many of these on the SEIU website. Your local union and SEIU's National Health and Safety Program, Nurse Alliance, or Healthcare Division can assist you in requesting and assessing this information. SEIU is also facilitating information sharing and training across locals. This webinar has been just one part of our work to help SEIU members understand the basics of Ebola preparedness. If a cooperative approach through your existing labor management committees or relationship doesn't get you the information that you need about your facility's plan, you also have a right under labor law to submit a formal written information request for this information. The National Union has a model letter that your local can use. And your local may have other ideas for how you can work together with your fellow union members to push your facility to work with you on this important issue. Local unions and our members should be included in the development, periodic review, and implementation of facility plans for Ebola preparedness. Our members' involvement and experiences are key to a plan that is effective in providing care for these patients while protecting the health and safety of our members. This concludes our webinar. Thank you for listening. Thank you for the work that you do every day to take care of patients. Please be aware this information is changing rapidly. We're working to keep this up to date, but be sure to check for the most current resources from federal, state, and local agencies and employers. Thank you.